Welcome. What does breastfeeding my newborn look like? After safely delivering your baby and giving yourself some time to recover, it's likely that one of the first things on your mind will be to start your journey with breastfeeding. First of all, let's explore some basic facts about breastfeeding and the advantages of this way of feeding. Breastfed babies are less likely to suffer from certain illnesses, such as respiratory conditions, diabetes, stomach bugs, allergies, and sudden infant death syndrome. They are also likely to have higher IQs and to be less exposed to heart disease or obesity later in life. Babies that are breastfed tend to have slower, more controlled feeding patterns. This therefore means that if a baby is breastfed, they are more able to self-regulate their appetites, which in turn means they will gain weight at an appropriate rate. Although it is not guaranteed, a baby is typically more likely to develop obesity later in life if they don't learn to control their appetites early on through breastfeeding. Breastfeeding means the mother will burn an extra 500 calories a day. This certainly helps shed a little pregnant weight. Other benefits for the mother include reducing their risk of osteoporosis, breast cancer, ovarian cancer, heart disease, and brittle bones. Breastfeeding also means your baby's nappies won't be as smelly as if you use formula. Many mums find that they need support to get breastfeeding off to a good start. Although most mums, 81%, start breastfeeding, this figure drops to only 17% by 3 months. Many of these mums stopped, not through lack of desire to feed, but due to lack of appropriate support. So if you're finding it tough, reach out for skilled lactation support. It can make all the difference. There are some common challenges in the early days that benefit from skilled support. These include latching issues, nipple pain, and a sleepy baby. More information on how to overcome these challenges can be found in our feeding journey. Now, let's explore some tips for latching on. If you're wondering how to get your baby to latch on properly, then follow these steps. Step 1. Sit comfortably on the sofa or bed, with your body weight well supported and preferably with a slight recline back, kind of relaxing in front of the TV position. 2. Bring the baby in close to your body so that they are looking up to the breast. Try to have their tummy tucked close into yours. 3. Let the breast sit in its natural position, as long as you can see your nipple that way, and bring the baby in close so their chin is planted onto the breast and the nipple is round about nose height. The chin touching the breast will anchor your baby in and encourage them to open their mouth wide. At this point, you can gently push the nipple into their mouth. When they're well latched, their lips will be sticking out, but often you won't see this as they're nice and close. If you can see lips tightly pursed around the nipple, this is likely a shallow latch. But how do you know if you're breastfeeding correctly? We understand it can be anxiety-inducing not knowing whether you're breastfeeding your baby correctly. After all, there's nothing more important than ensuring your little one gets a hearty meal. However, although there's no exact way of knowing whether your baby is getting the right amount of breast milk, there are signs you can look out for that signify that they are. For example, if they're being fed properly, mum should be comfortable during feeds and your baby will gain weight. They will seem sleepy and happy after a feed, and they poo at least a couple of times a day with a total poo volume comparable to 4 £2 coins at a minimum. In addition, it will be clear if your baby is latching on and sucking correctly, as their mouth will usually be wide open, their bottom lip will be sticking out, and their jaw muscles will be at work. However, if your baby appears to be making clicking instead of swallowing noises, has their lips pinched in a kissing shape, and their cheeks sucked in, then they could not be latched on properly. If you want to know that you're breastfeeding properly, then the best way to learn is to be shown exactly what to do by someone else. Although this might prove difficult in a busy hospital ward, persist in asking as many people for help as you can. Once you're home from the hospital, ask your midwife for help if you need it. In addition, you can also join breastfeeding cafes, local breastfeeding support groups, see a lactation consultant, or call the National Breastfeeding Helpline. What if you find you can't breastfeed your baby properly in an emergency? If you find yourself in a situation where you desperately need to feed your baby and you're not sure you're breastfeeding properly, then the best thing to do is to express the milk into a cup. Your baby can sip milk from this cup until you're able to contact your midwife, a lactation consultant, or your health provider for help. Although many people will advise against bottle feeding at this stage, bottles are most certainly okay to use in emergencies. So, to recap, after your baby is born, one of your top priorities will be to get the hang of breastfeeding. However, remember that this is a process and one that may take time to master. Be patient with yourself and be patient with your baby. Many new mothers face challenges in their early feeding journeys which can usually be overcome. You will know if you're breastfeeding correctly and your baby is receiving enough milk due to a few key signs. These signs include your baby being sleepy and happy after a feed, appearing to gain weight, and getting through 8 nappies per day. In an emergency, when you cannot seem to breastfeed your baby correctly, there are several things you can do. Although some mothers advise not feeding by the bottle at this early stage, in an emergency, it's perfectly fine too. Or you can express milk into a cup and feed it to them that way until you can contact your midwife for help.